Mr. Thiraios, you have the floor, sir. Right, good morning everyone. After the exceptional presentation by Mr. Bletzes, I think that we are now in the core of challenges for the healthcare system in Greece, as well as the challenges faced and the prospects envisaged by what we call digital transformation. We know that the aging population entails an increased cost in drugs, the reduction of budgets in health, the increase in chronic diseases and ailments, but also the needs of patients for service and the, extraordinary circumstances like the pandemic create an additional stress and burden in healthcare systems and the healthcare sector. And the question is, can digital transformation be a solution? Can it be a prospect and an answer to the inequalities in the provision of healthcare services? Can it be an answer to the assessment of patient care needs? And finally, through this digital transformation, can we improve the effectiveness and efficiency of the system offering healthcare services, while at the same time reducing the cost of these services? These are the topics we will try to discuss and touch upon with the exceptional participants of these sessions who have extensive experience on these issues to see a footprint of these transformations in the healthcare sector. We will start with Mr. Thomas Hellebrand, who will be joining us virtually.
Τώρα στην αρχή θα πρέπει να συζητήσουμε την συνεισφορά του ψηφιακού μετασχηματισμού στο οικοσύστημα της υγείας. Θα πρέπει επίσης να συζητήσουμε τις προτάσεις του ευρωπαϊκού χώρου Health Data για την χρήση των δεδομένων, την πρόσβαση των ασθενών στα ατομικά του στοιχεία υγείας και δεύτερον της δευτερογενής χρήσης για την ανάπτυξη πολιτικής υγείας και την έρευνα. Παρακαλώ τον δόκτορα Hellebrand να προχωρήσει με την παρουσίασή του. Καλημέρα σε όλους. Καλημέρα από τις Βρυξέλλες. Είμαι ο Τόμας και ευχαριστώ πάρα πολύ για την υπέροχη εισαγωγή. Εργάζομαι ως manager ψηφιακού μετασχηματισμού για την Digital Europe αυτή τη στιγμή. Θα ήθελα να ανεβάσουμε την παρουσίασή μου και να σας πω δύο λόγια για την εταιρεία μας. Είμαστε μια επιχείρηση η οποία έχει συνεργασία μεταξύ ιδιωτικού και δημόσιου τομέα. Ο ΣΕΠΕ είναι ένας από τους ελληνικούς παράγοντες. Όπως βλέπετε έχουμε συμμετοχή πολλών ψηφιακών εταιριών και εταιριών οι οποίες ασχολούνται με αντικείμενα με εξοπλισμό βιοτεχνολογίας. Έχουμε συνεργασίες με το Data Space και δυστυχώς η απάντηση στο ερώτημα που θέσατε νωρίτερα ήταν αρνητική. Θα σας έλεγα ότι η μεγάλη πλειονότητα των χρήσεων της ψηφιακής και της τεχνητής νοημοσύνης δεν έχουν σχέση με την υγεία. Έχουμε 7.000 δημοσιεύσεις, το 40% προήλθε από τις ΗΠΑ και 30% προήλθε από κινεζικά δεδομένα. Δεδομένου ότι εμείς θα θέλαμε να δούμε την ανάπτυξη της τεχνητής νοημοσύνης, αυτό δημιουργεί ανησυχία. Θα έπρεπε να έχουμε το data space, να έχουμε τον χώρο δεδομένων, αλλά θα δούμε με ποιον τρόπο. Και δεν είναι απλό, δεν είναι εύκολο. Πρέπει να δούμε την ανάγκη να δημιουργήσει αξία, να δημιουργήσουν αξία αυτά τα δεδομένα. Θα ήθελα την επόμενη διαφάνεια και θα ήθελα να περάσουμε αυτήν για να παραμείνουμε στα 6 λεπτά που μου έχουν διατεθεί. Λοιπόν, πώς μπορούμε να ξεκλειδώσουμε, αν θέλετε, την αξία των δεδομένων υγείας σε οικονομίες κλίμακας. Θα δούμε τη διακυβέρνηση σε λίγο, αλλά τυχόν διόρθωση των δεδομένων δεν είναι κάτι ιδιαίτερο. γίνεται σε μια ξένη γλώσσα ή σε μια μη επεξεργασμένη μορφή και υπάρχουν ένα σωρό περιορισμοί. Επομένως, για να ξεκλειδώσουμε την αξία χρειάζεται να έχουμε έξυπνα συστήματα, τα οποία θα μπορούν να εφαρμοστούν σε εφαρμογές της πραγματικής ζωής. Θα πρέπει να είμαστε διαφανείς και να εμπιστευτούμε την διακυβέρνηση. Υπάρχουν κάποια συστήματα στην αγορά, τα οποία έχουν αναπτυχθεί στην αγορά. Θα πρέπει να δημιουργηθεί αξία, επομένως οι εταιρείες επενδύουν εκατομμύρια επί εκατομμυρίων, παίρνοντας ρίσκα για να δουν αν τα μαζικά αυτά δεδομένα μπορούν να χρησιμοποιηθούν για να απαντηθούν φλέγοντα ζητήματα. Χρειάζεται να γραφούν πάρα πολλοί αλγόριθμοι πριν ακόμα ελεγχθούν οι αλγόριθμοι αυτοί οι οποίοι κάνουν την ανάλυση. Όταν εφαρμόσουμε αυτές τις γνώσεις σε δυναμικά δεδομένα, τα οποία χρειάζονται για κάποιες από τις έρευνες τις οποίες είδα να παρουσιάζονται από τους προλαλήσαντες, έχουμε ζήτημα. Βλέπετε δεξιά στη στήλη ότι δεν θα μπορέσει να κρατήσει αυτό επί μακρόν. Θα πρέπει να βελτιώσουμε την εμπειρία των ασθενών, να μειώσουμε το κόστος της υγείας και να βελτιώσουμε την εμπειρία των κλινικών ιατρών. Επόμενη διαφάνεια παρακαλώ. Εδώ έχουμε την πρόταση για έναν ευρωπαϊκό χώρο δεδομένων υγείας. Αυτό παρουσιάστηκε στις 30 Μαΐου. Υπάρχουν πολλά πράγματα σε αυτήν την διαφάνεια, δεν θα σας τα παρουσιάσω όλα, αλλά θα ήθελα να πω ότι είναι μια πάρα πολύ περίπλοκη πρόταση και θα ήθελα να σας πω δύο λόγια. 4 πράγματα σε αυτή τη διαφάνεια τα οποία θα κάνει η πρότασή μας. Το πρώτο είναι τα δικαιώματα των ασθενών στους ηλεκτρονικούς φακέλους ασθενών. Να έχουν πρόσβαση στα δεδομένα τους και να έχουν έλεγχο επί των δεδομένων τους. Στην Ελλάδα φαντάζομαι ότι υπάρχει μάλλον ένα κατακερματισμένο τοπίο της υγείας και τις εκατοντάδες νησιών όπου οι κάτοικοι τους θα μπορούσαν να υποφεληθούν από τηλεϊατρική φερειπίνη ή από αυτά τα δεδομένα. Υπάρχουν και συστήματα τα οποία κάνουν την πιστοποίηση. Θα είναι μια αυτοπιστοποίηση όπου οι κατασκευαστές αυτών των συστημάτων θα δουν πόσοι μπορούν να συμμετέχουν. Θα έχουμε διαλειτουργικότητα, ασφάλεια και βεβαίως πρόσβαση στα δεδομένα. Και τέλος έχουμε τη δευτερογενή χρήση των δεδομένων. Προβλέπεται μια δυνατότητα διαμοιρασμού των δεδομένων. Θα μπορούν οι χρήστες των δεδομένων να τα αξιοποιήσουν για την έρευνα και για την ανάπτυξη τεχνητής νοημοσύνης με πολύ αυστηρή αδειοδότηση. Θα υπάρχει ένας φορέας στην Ελλάδα που θα εκδίδει αυτές τις άδειες, αλλά θα υπάρχουν και άλλοι τρόποι για να αποκτήσει κανείς άδεια χρήσεως αυτών των δεδομένων. Και αυτό θα μας δώσει τροφή για σκέψη για την επόμενη δεκαετία. Και εδώ έχουμε πολλά στοιχεία. Η Ευρωπαϊκή Επιτροπή πραγματικά υπερεύει αυτήν. Υπάρχουν βεβαίως κάποιοι τομείς στους οποίους μπορούμε να έχουμε βελτίωση και γι' αυτό είμαστε εμείς εδώ. Έχουμε ασφαλείς ηλεκτρονικούς φακέλους ασθενούς, έχουμε ένα συντονισμό της τυποποίησεως που δεν είναι εύκολο να επιτευχθεί, ο στόχος είναι για το 2030. Δεν έχουμε φτάσει όμως ακόμα εκεί. Έχουμε τις πρώτες αντιδράσεις μας όταν υπευλήθησαν όλα αυτά στην Κομισιόν, όπου πώς θα μπορούσε να βελτιωθεί η νομοθεσία φερειπίν. Τώρα εργαζόμαστε σε συνεργασία με τον ΣΕΠΕ από Ελλάδος και θα ήθελα να μοιραστώ μαζί σας κάποιους χώρους όπου μπορούν να μας δώσουν τροφή για σκέψη. Πρώτα απ' όλα είναι η μείωση της πολυπλοκότητος, η διευκόλυνση και η απλούστευση των διαδικασιών, το οποίο θα μπορούσε να επιτευχθεί ίσως αν υπήρχε ένας κεντρικός φορέας. Η βοήθεια στην οικονομία. Από πλευράς εταιριών όμως, ίσως να είναι δύσκολο να δούμε ποιο είναι το πλεονέκτημά τους και θα πρέπει να υπάρχει μια σαφής αξιοποίηση από πλευράς των επιχειρήσεων. Θα πρέπει να δούμε όμως με ποιον τρόπο μπορούμε να εγγυηθούμε την ασφάλεια και την συνέχεια των δεδομένων. Πώς θα μπορέσουμε να έχουμε ασφαλή διαμοιρασμό προσωπικών και μη προσωπικών δεδομένων. Η μείωση των δεδομένων δεν σημαίνει ότι θα έχουμε απολύτως μεγαλύτερη ασφάλεια. Οι κυβερνοεπιθέσεις σημαίνουν ότι τα στοιχεία θα πρέπει να είναι όχι μόνο αξιοποιήσιμα, αλλά να είναι και ανακτήσιμα σε περίπτωση επιθέσεως. Το λιγότερα δεδομένα δεν σημαίνει ότι θα έχουμε υψηλότερη ασφάλεια και υψηλότερη ανθεκτικότητα, γιατί θα πρέπει λοιπόν να έχουμε ένα σύστημα το οποίο θα μπορούσε να είναι πολύ πιο ανθεκτικό από αυτό που έχουμε σήμερα. Ο EHDS, ο Ευρωπαϊκός Χώρος Δεδομένων Υγείας, θέλει να αποφύγει τα μποτιλιαρίσματα και να μπορέσουμε να αποκαταστήσουμε μια ταχύτατη πρόσβαση των επιστημόνων σε όλα αυτά τα δεδομένα για να προαγάγουμε την έρευνα. Ευχαριστούμε πάρα πολύ τον Τόμας Hellebrand, Manager ψηφιακού μετασχηματισμού της Digital Europe. Νομίζω ότι έχουμε μια ξεκάθαρη φωνή και μια ξεκάθαρη πρόταση για την βελτίωση, την ψηφιακή εμπειρία των πολιτών. Προσπαθούμε να κάνουμε αυτό που λέμε στην Ελλάδα, να μιλήσουμε για αυτά τα θέματα από της ελληνικής πλευράς.
So we will move on to IDIKA and Mrs. Fotiadou, Head of Special Application Sub-Directorate, Application Operations Support Department. Now in digital transformation, IDIKA is the national hub of digital health. So where are we in terms of infrastructures and collaborations and contacts, and all the more, all this digital transformation through the design of IDIKA, how much does it respond and correspond to the needs of the citizens? How can their data follow them in the journey in the health system to a safe and to a safe journey, and how much access do they have to their data at the moment? Right, thank you very much for the invitation. Allow me to move to the podium. I apologize for having my back turned to you, says the moderator. Can we please have Mrs. Fotiadou's presentation? Right, so is the clicker here? Thank you very much for the invitation. Now, digital transformation of the health sector, challenges and opportunities. We can see that our transition to electronic health started a decade ago with the implementation of e-prescription, a nationwide application that covers 100% of the population. Now, during the pandemic, we transitioned to the next e-prescription. Approximately 4 million citizens have registered with e-prescription, with intangible prescription. Over 40% of the prescriptions and the referrals issued are intangible. They are digital. One could say that intangible prescription signals digital transformation in the health sector. In the application of the primary healthcare system, I should like to focus on what started in August, and now all citizens are now registered through gov.gr with our personal doctor. We have implemented a new edition of e-appointments so that citizens may make their electronic appointment. And this application now supports appointments both in primary and secondary healthcare. Now, in 2020, with the pandemic in Greece, we saw the implementation of a series of e-applications, digital applications of electronic health. The national patient registries started due to the conjuncture with the national COVID patient registry, subsequently followed by the National Registry of Cystic Fibrosis Patients, a registry that includes the ensemble of patients in Greece, and updates with information the corresponding European Registry of Cystic Fibrosis Patients. We had the implementation of the National Registry of Children and Adolescents Neoplasms, as well as the Vaccinations Registry, starting from the flu vaccination of 2020. And with the start of COVID vaccination, it was enriched with the COVID vaccination data. This year, we added to the National Vaccination Registry inoculations of children and adolescents. In 2021, we developed the medical certification subsystem, starting with sick leave for EFCA insured persons. In this subsystem, we saw the development of many certifications. Mr. Thiraios knows this very well because he was a member of the committees on the approval of these certificates to handle the pandemic, primarily for the prioritization of our fellow citizens belonging to vulnerable groups regarding their vaccination. Subsequently, the in-house COVID vaccination certification for our fellow citizens with mobility problems, and as of November 2021, we have the medical certificates and attestations for the administration of monoclonal antibodies and antiviral drugs for COVID patients. The self-test subsystem was an entire system managing the self-tests and receiving these self-tests from the pharmacies, which we have all done inadvertently. And obviously a central point of reference in the national healthcare system is the personal patient's file, the personal health record, rather. It is designed to be interoperable with third systems. It already works very well with e-prescription, patient registries, e-certificates. It is updated by the treating physician and the family doctors. It has been enriched with our pediatric history. And the next step is to be updated with hospital discharge papers and from the results of test labs. It includes a host of units like personal and family record, hospitalizations, inoculations, drug treatments, allergies, social habits, and other things. It is a recording of health data of citizens. All this brings together a health system subsystem of national range and radius that gives a lot of chances and opportunities to design and draft health policies that are evidence-based. It gives the opportunity for rationalization of pharmaceutical expenditure and support for healthcare professionals. In all these systems, we have accumulated a huge amount of data. The mega data or the big data of health that provide us with a host of opportunities for the utilization, always aiming at the optimal management of citizens' health, public management, public health through innovation, and the innovation through medical research and clinical study, and the streamlined distribution of healthcare resources to the benefit of the citizens. Obviously, a key requirement is the anonymization of data and abiding by the GDPR and informing citizens as to how their data are being utilized. These big data were utilized during the pandemic because it was on the basis of the prescription data that we determined the groups of our fellow citizens who had to receive an inoculation as a priority on the basis of their diagnosis or the pharmaceutical treatments as drawn from e-prescription. These data were also utilized in preventive medicine actions that were initiated by the Health Ministry. The General Secretariat of Public Health already has started the asymptomatic screening of breast cancer. We prioritize people using specific criteria like age, gender, diagnosis, and previous diagnostic tests undergone by the population. For the population target, referrals are automatically created, and if the citizens have activated e-prescription, intangible prescription, they receive a text on the smartphone or an email regarding these referrals. The next step which we want to take in 2023 is cross-border e-health services. IDIKA has already been appointed as a national reference point for e-health, and we will start with two services in the beginning. First of all, the exchange of the comprehensive or summary history of the citizen and executing prescriptions with pharmacies of another member state of the EU. As regards citizens' access to their data, well, obviously they can see that through the personal health record. It's their data and the access to that data. And in 2021, we also implemented another application, which is called My Health, that can run on mobile devices, phones and tablets. Through this application, citizens may see their prescriptions, their referrals, their medical certificates, and the inoculations of their children. They may receive significant and important notifications, and it is our vision for this application, My Health, to become a personal health record of citizens in handheld devices. In mid-September, this application received the first award in the first competition for innovation in the public sector, health innovation. This is a schematic of the interoperability of the systems we have developed. IDIKA supports interoperability through open models and open standards, and I would like to focus for a moment on the digitalization of COVID-19 inoculation. Now, it's impressive for Greece, and I would call it best practice worldwide, because it was a full digitalization of all processes from day one, from the prioritization of citizens for inoculation through the GSIS, determining which are the vulnerable groups from the BI and e-prescription data, the e-appointment platform. The messages of those, the text messages of those who had e-prescription about the proposed appointment for inoculation, the date of the inoculation, and the interoperability of the registry of inoculations and COVID-19 patients with gov.gr, so that patients may easily issue their digital certificates, a vaccination certificate, and the recovery or recuperation certificate. I think it's unique, it's one of a kind, and we must be proud of our country for this achievement. These are the benefits from the digital transformation of the health sector. There are multiple. I will briefly refer to the safety of patients, to the provision of high-quality services, transparency, the simplification and acceleration of procedures, and the possibility and capability to offer services, modern health services. Now, obviously, the requirements for the sustainability and success of digital transformation in health are the existence of a national network of interoperability for e-health services, as there are many systems, many data sources, and all these need to speak to one another, because for each citizen, their data, their health data, need to be accessible by themselves and their physicians through the personal health record, which can show HCP's data from various sources. We need to have central codifications and nomenclature, and the systems we implement need to be easy to use, so as to have the support of the users, the healthcare professionals, for them to be adopted, to be used, to be utilized, and yield the most results possible. Naturally, a cornerstone for sustainability is the collaboration of all of us who are involved in digital health. Thank you so very much for your attention.
I believe that through this presentation of Madam Fotiadou, we saw perspective vis-à-vis inter-European policies for the development of IDIKA, for the investment on infrastructure, and an excellent example was the vaccination mechanism. The critical issue is what you mentioned at the end, that is the national interoperability plan. On one hand, we have an excellent network which reaches the doors of the hospital. What happens, however, within the hospital, the possibility of interoperability with patients, and on the other hand, to exploit digital health and applications as a good example through interoperability. How close are we to that? I believe that would be the next step. I think that we have entered a maturity phase, and all that can be accelerated. What has been materialized over the last 2 years on the previous velocities we had might take a decade. It seems, therefore, that with the development of technology, all these are accelerated. Yes, and in concluding, listening to Mr. Hellebrand as well, is that a clear European Union framework for the benefit of patients. On the critical issue, however, of the experience drawn by bodies such as IBM, and I come to Mr. Primpas, who is head of consulting services for Greece and Cyprus of IBM. We would like to see the development of new integrated treatment models, digital models that is, by securing the continuation and custom-made care. Mr. Primpas, you have the floor. Thank you. Thank you for the invitation to participate in this conference. The presentations made till now were very interesting, and Madam Fotiadou has said important steps have already been made in Greece for the introduction of the e-file and e-system in the health sector. We operate as a technological consultant, all suppliers participating with a series of agencies in the health sector, be it ministries or hospitals or the social security funds, because the ecosystem of the health sector exceeds what we traditionally used to say the main central services or hospitals. It's far broader system and embraces all hospitals and the relations not only of the patient with the physician, but all procedures, the procurement process, the way services are priced and reimbursed by social security funds and insurance companies. It covers the care of the patient outside the hospital, where through digital solutions we have monitoring of vital signs and a series of data that where the patient can record and send it to his physician. Therefore, there's a drastic dramatic change to the whole ecosystem, and this creates an extended need so as to handle a great bulk of data that must be available to a plethora of applications and agencies, and have an interoperability of all those applications so as for them to be available in real time and at any time in the health system of each country. Therefore, in IBM, we consider that it's extremely important to dwell on some basic principles of the solutions. The basic principles are to leave silos and limitations that traditional health systems had. For instance, in many hospitals, we've seen local applications that cannot have interface with central operations. IBM has made huge effort to correct such problems in Greece. We've seen similar projects and applications abroad, where through national strategies or strategies of the hospitals, depending on the way each country manages its hospitals, similar projects have been implemented. Indicative examples are, for instance, in the Barcelona hospitals, where we have full e-files, e-management of patients, integrated management and integration of the basic hospital operations through IT systems, so as to be monitored in an integrated way through KPIs, and the patient having full image of the exams and lab tests he's been through and follow his vital signs. Similar experiences we have drawn from many other projects all over the world. In Greece, we have an important experience in the health sector, and we continuously invest there. What we believe as IBM, and is most important, is in the field of health to leave the limitations of the past and move towards a paradigm where we will be monitoring open data, keeping the principle of security, where specific directives and the GDPR, if you like, will be observed, on what terms the patient's data will be available, and all that will be based on open standards so as to have interoperability. These three main principles are the ones that must govern all applications in the health sector. And as I said, we exceed from the traditional paradigm of in-hospital management. We enter a far broader ecosystem, including all patients, all physicians. The patient is to have access to his own data. We enter rationale where everything is interconnected through IPIs, the social security funds, the insurance companies. So this whole ecosystem is broadened significantly. Important projects are currently in operation in Greece, and we mobilize people from all over the world to help in projects in our area in Greece, wherever this is needed. Thank you. We thank you, Mr. Primpas. I believe that with your presentation, you gave a full picture of the existing technological capacities we have for an integrated digital health system. In the core, of course, of your good practices and IDIKA, we should not forget two important factors. One is who updates the data, the cost of time of the health professionals, the user-friendly data, and the capacity to manage various applications, so as to really speak of an accuracy and complete set of data, so as to serve in their secondary use and also for the clinical work of physicians. And on the other hand, the investment that we should make on health professionals and their empowerment in what we call digital literacy. They must be trained in that. We must have an ongoing training so as to really have benefit. So from this viewpoint, raising a joint common question to both the representative of IDIKA and you, how do you support this part of health professionals training, and how is that accompanied? Yes, this is indeed an issue, and we should support the health professionals in that. What we have started quite recently is to also create training videos. During the COVID period, we had weekly training sessions for physicians on the COVID platform, especially the lab physicians. And this should be better organized, that's true, the way that is we train health professionals in the use of the various applications. From your side in IBM, such solutions? Well, these are most pertinent questions. The first is how we upload data and how we manage data. Technology is here to help, of course. And there are many examples where through digital solutions we can feed the data, the systems with data. They should be, of course, imported on the right way and the right structured way so as to be available and exploitable in the future. So in this part, technology can definitely help, and they have excellent good cases. In the training aspect, as Madam Fotiadou said, yes, indeed, we must be continuously training physicians. Digital technology evolves rapidly, and physicians must be able to follow suit of all those solutions we offer. So continuous training has to take place here, and the experience from similar projects show that we have either the use of digital technologies, videos, on live training that has to be ongoing, because we have this rapid and continuous evolution of digital health systems. Let me also add that the interoperability of systems helps. For instance, the prescription protocols. The physician must upload the lab results. If they are automatically fed in the system, the physician's life becomes easier. So there are many ways that we can help the users of the health systems, both through training but also in with other methods. So through these methods, through this data, we enter an era where through AI we can have tools. How close are we for the beneficiaries, the end beneficiaries, the patients, to benefit from these tools? Madame Gazouli, who is a biologist and professor of biology and genetic nanomedicine of Faculty of Medicine, has the floor. Thank you. Mr. Bletzers already made an excellent introduction on AI and what will bring along. Well, AI is interlinked with digitization of health because it offers the tools so as to use them. AI has entered our lives. We hear that we use algorithms in AI. It offers many things in diagnosis, in training, for the repurposing and of various medicines that we already know. We can also use them for other diseases and will definitely offer saving of time and resources. And the most well-known use of AI lately is machine learning. We already use it in order to have models of the genetic analysis we do and accuracy medicine benefits from this use, and their use will be most important over the next years. First steps have already been made. In Greece, we do not lag behind. Many labs and many teams work in this field, amongst which my lab as well, in cooperation with the University of Peloponnese and Professor Mr. Souliotis. We work in a European project that aims at combining genetic information, the one we get from imaging, the information we get from biochemical lab tests of the patient, the information drawn from all clinical practices that each patient undergoes, so as for each one to introduce all the data in one single platform, so as for the physician to quickly know whether this patient is eligible for immune therapy or not, without making the patient running around with his file in arms, consulting various physicians. The goal of this program, additionally, is something where problem is on how we assess the quality of data we introduce. Since in order to have the right result and the AI algorithms to offer the right result, we should be able to cross-check the data. That is, that this system is correctly trained and fed with the right data so as to have the right result. So this effort aims and goes towards this direction, and we hope that by the end of the 3-year program to have enough improvement and data. The point is how AI, along with digitization, will transform the health sector. The point is how the beneficiaries and the suppliers will benefit from this effort. We've already seen the first result from the work done with IDIKA, and are impressive. But more things have to be added on this chess field. For instance, all that AI will contribute in exploiting more substantially the e-files of the patients, and therefore important results and conclusions will be drawn, or could have a better diagnosis. As we said, it will be decisive in having a better repurposing of the existing treatments, to have them used for other treatments. We will select the right patients for right therapies. We will have better processing of the archives. And the wearables, the smart devices that is, are important. They must also be integrated in the whole process. They should be digitized and be also fed in the e-file, because with a simple pad or a watch we'll be able to have a monitoring of the patient's health. many solutions are given, and therefore in real time we will be having an easy monitoring of the patients without having to have recourse to microlabs and so forth. In order, however, to have the full-fledged integration of digital health, we must do away with certain regulatory barriers. Some things have already been heard. Who has the information and how does one use the information? And another barrier is GDPR. GDPR has offered a lot of right approaches vis-à-vis the use of the patient's data. When, however, we have to train such systems, the rules are so austere that we are really have our hands tied. We cannot collect and use data for training, and that causes a lot of problems. We also need the more flexible legislation. We must also raise the question on who bears the liability. If we do not have the right advice, who bears the liability? The machine, the physician, or the microbiologist that did the test? There are legal gaps. And there's also a great delay of regulatory authorities in approving new technologies. That is, the facts and developments catch up with us. But once these problems are solved, digitization, along with AI, will solve a lot of problems of sub-staffing, will contribute to gaining time in documentation and decision-making process. We will have a more affordable healthcare system. So adopting new technologies offers far better experience to the patient. We've already seen that. And I believe that it is worth investing time and resources towards this direction. Thank you. Excellent. I believe that Madam Gazouli, you covered all the things and all the viewpoints and raising also the limitations and where we should invest more. You raised the issue of the code of conduct and morality, the issue of the institutional framework. And of course, let us not forget that we have at the center, always we have the patient. The use of those digital tools actually changes the way it operates, extending from the hospitalization to the home care, the exercise of medicine for us professionals. The truth is that patients, to a large extent, despite the problems of what we call how familiar they are, they do participate actively in that. And cooperation in this field is important. On the other hand, an important issue is what was demonstrated from all papers and the proposal made by Dr. Hellebrand. That is the creation of this subsystem of digital health, which is the institutional agencies, the health professionals, but let us not forget that investing in digital health is a growth pillar of a country, and this was fully demonstrated during the pandemic. Μιλάμε για την ανάγκη ανάπτυξης ενός οικοσυστήματος ένα οικοσύστημα στο οποίο θα μετέχουν όλοι οι κοινωνικοί εταίροι για να προάγουν την καινοτομία στην πρόταση που γίνονται στον τομέα υγείας. Ο καθηγητά Hellebrand.
Πόσο κοντά βρίσκεται η Ευρωπαϊκή Επιτροπή στην ανάπτυξη αυτού του οικοσυστήματος και αυτής της δικτυώσεως? Ευχαριστώ πάρα πολύ για την ερώτηση. Κοιτάξτε, βρίσκομαι αυτή τη στιγμή πολύ κοντά στην Κομισιόν, αλλά εμείς εκπροσωπούμε τα συμφέροντα επιχειρήσεων σε όλη την Ευρώπη και συνεργαζόμαστε πολύ στενά με την Κομισιόν και αντιλαμβανόμαστε τι προσπαθεί να επιτύχει. Το ερώτημά σας είναι ως προς το πόσο κοντά είμαστε. Κοιτάξτε, δεν είναι γεωγραφική εγκύτητα. Έτσι, υπάρχει αυτή τη στιγμή μια πρόταση. Μια πρόταση η οποία θα πρέπει να υιοθετηθεί και από την Ελλάδα μέσα σε 2 χρόνια, αφού αυτή συμφωνηθεί. Πρώτα θα πρέπει να τύχει συμφωνίας και να ψηφιστεί από το Ευρωκοινοβούλιο. Κάτι το οποίο θα πάρει χρόνο, διότι υπάρχουν πάρα πολλά θέματα προς συζήτηση. Εν τω μεταξύ όμως, το δίκτυο υγείας υπάρχει ήδη και λειτουργεί και ανταλλάσσει τέτοια στοιχεία. Αυτό που προσπαθούμε να κάνουμε είναι να υπάρξει μια σύγκληση ώστε να επιτρέψει την διασυνοριακή ανταλλαγή δεδομένων. Και να θυμίσω ότι υπάρχει ήδη ένα πιλωτικό πρόγραμμα το οποίο τρέχει αυτή τη στιγμή για τη δευτερογενή χρήση των δεδομένων. Ορισμένες χώρες της κράτη-μέλη της Ευρωπαϊκής Ενώσης συμμετέχουν. Η Ελλάδα, από ό,τι αντιλαμβάνομαι, δεν συμμετέχει. Ίσως είναι μικρότερες οι χώρες που συμμετέχουν. Και γίνεται τεράστια προσπάθεια προκειμένου να υλοποιηθεί αυτό και να υπάρξει διαμοιρασμός των δεδομένων σε όλη την Ευρωπαϊκή Ένωση. Υπάρχουν κάποια θέματα με τον GDPR, με τον Γενικό Κανονισμό Προστασίας των Προσωπικών Δεδομένων. Ίσως να είναι πιο δύσκολο το να μπορούμε να κάνουμε πράγματα χρησιμοποιώντας δεδομένα υγείας με το GDPR, ειδικά όταν δεν μιλάμε για την ίδια χώρα. Αυτό το πιλωτικό πρόγραμμα παρουσιάζει ιδιαίτερο ενδιαφέρον. Σας παροτρύνω να το παρακολουθήσετε, να προσεγγίσετε την κυβέρνησή σας και να συζητήσετε μαζί της αυτήν την πρόταση, η οποία βρίσκεται αυτή τη στιγμή υπό συζήτηση. Θα πρέπει να δείτε τι είδους δεδομένα θα πρέπει να καλύπτονται, τι είδους πιστοποίηση θα πρέπει να δίδεται για τη χρήση των προσωπικών φακέλων υγείας, για τις βιοτεχνολογικές συσκευές, πώς θα μπορέσουν να υλοποιηθούν και να ενοποιηθούν τα στοιχεία και τα δεδομένα από τις διάφορες PAS κατά αξιόπιστο τρόπο. Σας ευχαριστούμε πάρα πολύ.
Mrs. Fotiadou, on the basis of this approach and the spirits of collaboration of within the EU to support such subsystems of health data and health services, are we any forward? Are we advanced on these things? Do they have to do with entrepreneurship? Do they have to do with the development of applications? What is the role of IDIKA? I believe that we are at a level of maturity to get the ball rolling, as it were. We have a lot of data. We need to invest in in the interoperability of these systems, and subsequently to take the following step. We also strongly participate in the events all over Europe as the Ministry of Health and as IDIKA for the utilization of data and for the secondary use thereof. In Europe, medical devices are being prescribed and other things as well, and we need to move on to that as well. We need an appropriate legislative infrastructure and framework. So it's more easy, as we've seen of late, to implement something technologically rather than to institute the framework, the institutional framework. So we need a framework, a legal framework, for the utilization of this data, for open data. This is the key thing. If you have the necessary institutional framework, you can do things. The technology is out there. Mr. Primpas, do you believe that this institutional framework does really want to help you more in your work, or from your experience you feel that you have the environment and the know-how to develop all these things? I believe that the framework, the legislative framework, is evolved and is evolving in the EU, but it will not be restrictive to the steps we need to take. Okay, in Greece and in Europe alike. Okay, in Greece we took some important steps forward, and it's a huge endeavor being made by the ministry in IDIKA in particular. A series of actions have been designed, they're being announced currently. They will enhance our efforts and they will speed up our process. As we said, solutions are out there, technology is there, and the aim is to help patients, to help doctors. They do not replace or substitute doctors or any other healthcare professionals. What we need to do is to put it in good use in a proper way, to utilize in the long term, properly and appropriately, by maintaining appropriately the health data of each one of the patients, and to utilize it appropriately using, well, AI or a series of technologies that are available or will become available in the years to come. I believe, Mrs. Gazouli, you showcased this in your example with your collaboration with the University of the Peloponnese. It's very crucial to ensure the participation of the patients and particularly the feedback we receive from them. I believe that in this direction you do have such experience, correct? Yes, we should not leave the patients outside. They need to be trained and informed on the advances of technology so that they may participate in the proper way. This is key. So I believe that on this optimistic note, these messages, and maybe with a final approach, that probably digital transformation is good for your health. And it is definitely a pillar for development and growth for the country. We should like to thank everyone for giving us this opportunity to have this discussion.
Ευχαριστούμε πολύ και τον Δόκτωρα Hellebrand για τη συνεισφορά του.
Thank you so very much indeed, one and all.